Hi guys, welcome back. This is episode 5 of the Paint Your Face podcast, and today I'm painting the face of the gorgeous Steph.
My name's Steph. I'm a midwife. I also do aesthetics. My business is Arise Aesthetics Limited. I work from Korea Medi Spa, and I've been doing aesthetics for a few years now. Just launching a new treatment in there, which is to do with vaginal rejuvenation.
And are we going to talk about that today?
We are.
Exciting! Although a bit nervous, it's a bit of a taboo subject, isn't it?
It is very much a taboo subject, but we need to talk about vaginas.
Vaginas. Why are we like blushing even saying it? Do you not think?
I think it's because I know that people. I can talk about vaginas. I'm a midwife. I do vaginas, but I always say I'm very comfortable with vaginas. But people aren't, and it's a taboo subject, and like 50% of the population has a vagina.
Mm-hmm.
But we don't talk about it, and people get nervous, and I think it's because other people get nervous and embarrassed about the word vagina, never mind talking about vaginas.
Do you think it's a cultural thing? Like our parents, our grandparents, it would have been like no chance we're going to talk about anything. Then our generation would have been like, okay, we're saying stuff and we think we're cool, but there was a cutoff, and it probably was the vagina. Like we wouldn't have we meet with our friends, we talk about sex, we talk about, different things that are a bit like, ooh, but you kind of don't talk about like, how's your vagina? Have you got bits hanging out? Are you not? Are you? But then do you think the newer generation, like the younger ones who do seem to be more open-minded, like are they maybe sitting around talking about their vaginas?
I would like to know if the young people wanted to say, but the young generation are more liberal. I don't know if it's because they're seeing more things online or they're more exposed to things.
So I've actually already done Steph's skincare so that we don't have to, record through that. So we've cleansed, we've toned, we've applied some moisturizer and serum, and now we're going to go straight on to brows and some primer. Okay. Yeah. So I want to also discuss with Steph, I've actually had a treatment, not on my vagina yet. I mean, after talking to Steph about this treatment that she offers that we're going to discuss, I feel like it's coming my way. Everyone's way? Really?
Most people.
Oh no. So, well, that's fine. At least there's a solution to an issue. But yeah, so far not my vagina, but we did have a treatment, polynucleotides. So should we maybe talk about that first of all, and then people can stay watching and listening to then hear about the new treatment that you're talking about. So tell us because I have talked about the polynucleotides because I obviously had it. I feel like I don't say it right because I'm not 100% sure what it does. So if you could maybe explain that a bit more while I get some product.
As we age, we lose collagen. Actually, from about 25-ish, you lose quite a lot of collagen in your skin year on year. And ways to stop that is to use an SPF, a good skincare routine. But if you have already seen a reduction in collagen, which you probably have, you get around your eyes, they can get dark, they can get sunken, the skin just becomes a lot thinner, and polynucleotides is
salmon sperm. You're like, no, not salmon sperm.
It's an option to have injected around your eye in order to increase your collagen levels. It's not salmon sperm. It is derived from salmon DNA. So it's not actual salmon sperm that you're injecting. And the actual injection or the product in your skin only lasts a very short time. But what it does is it starts a chain reaction around the area where it's injected to produce more collagen.
Because I think when people said, what was it and what did you have it for, I'd said, like, I really noticed that the skin around my eye area was looking more hollow and therefore darker and grayer. But also, I will be 40 this year, so lines and wrinkles were a bit more prominent than I wanted them to be. And my skin was a lot more hooded in the eye than nobody wants that, but more than I wanted it to be. So to me, it was a kind of first start into injectables.
But one of the more natural treatments that you can get. So it's not changing anything. It's not freezing anything. It's making the skin go back a few years, really.
So I had it. And I would say I definitely notice. I think even in my camera I can see in this mirror. But remember I had said to you, and you can see the subtle difference in the before and afters. I think maybe if you are really unhappy with your skin, or you're really conscious about lines and wrinkles or elasticity, then it's maybe not going to be enough for those people. But for that sort of like rejuvenation, slight little tweak that nobody would know, but you look a bit fresher.
You feel it in yourself.
Then it's a really good treatment. Who would have polynucleotides? Is there a, is there a cut off? Obviously, this treatment maybe needs to be done on people who are over 16 or 18, but then is there an area where it's too late for it?
Like if you've got excess hooded eyes, like polynucleotides isn't going to get rid of it. If you're really bothered with it, then you can get like operations for that. But if you're looking for a rejuvenation or a bit of brightness, then probably that. Like you need to have a realistic expectation. Like it's not going to take away your lines and wrinkles. It's not going to take away hooded eyes or big bags. It's just going to improve it a little bit.
Yeah. I'm going to apply some foundation to you now. You have a good tan. Is that just from the last couple of weeks? It's been lovely in Scotland. So when I'm using the Face Atelier foundation, I'm actually dotting a little tiny bit of pink in there, and I'm just going to mix that up and check that it's going to be more appropriate for your skin color. So it's the tiniest bit of like neon pink, like very pink, but actually it's just going to blend really well into that foundation. And you might not be able to see that, but the residue right there, that was more yellowy, wasn't it? So hopefully then with a little bit of that pinky, that's a little bit more appropriate for your skin tone. I'd already done your primer, and we've used the Estee Lauder Double Wear primer. And then, like I said, this foundation is the Face Atelier. So I'm just applying a little bit, going down. So what sort of other treatments, apart from, I know we're going to talk about the vaginal one, but what other treatments do you offer in the salon?
Botox filler, lip flip, which is quite good for people that they feel like they don't have a large, or they feel like they have a small top lip and they would like maybe a little more to be seen, like they feel like their lip disappears when they smile.
So I'm just going to apply the Natasha Denona concealer in shade 4, and this is a slightly more pinkier tone as well, so it's going to be nice and fresh as opposed to something that's going to be slightly more yellowy. So I'm going to put that in the inner part here and the outer part here. And then I call them Romeo and Juliet, and they want to be in love and get married. So then we're like, okay, guys, we spread it across so that no new product has been added underneath the eye directly. It's more the outer edges. And then I can actually place that over the eyelid as well, just to cancel out that slight discoloration on top of the eyelid that we all suffer from. So let's talk about the biggie treatment there.
So obviously, being involved in women's health, I want to help women's health. Obviously, that's what I want to do. So I get into aesthetics, and then I quickly learned that there was this thing called vaginal filler. So I looked into it a bit more and kind of learned what it was for. So then when I realised that actually this vaginal filler was to help people that suffered from the hormone imbalance, which then causes vaginal issues, then I thought, well, if I can help these people, I would like to. So this can happen generally. You can have hormone imbalance, or after pregnancy, after breastfeeding, after going through the menopause, after cancer treatment. Then that's the kind of main people that the treatment would be aimed at. But ultimately, some people can just have these issues, and they can also have the treatment.
So what are the issues that you're talking about?
So issues may be vaginal dryness, and you would know that you've got vaginal dryness if you're sore when walking, during or after intercourse. Someone described it to me as like when they're walking, it feels like, do you know that when if you have like the end of your period maybe and you're using a tampon and you take it out and it's dry. So that's like that pulling feeling. So they're walking about like that all the time. It's not normal.
And it can be treated?
It can be treated. So it depends on, if you think of the vagina, you've got the labia majora, which is the external lips, then the labia minora, which is the internal lips. And most of the time, women have, you'll see them, they're the ones that hang down a little bit.
The bits here that.
So these cushiony bits, and then you have like your labia minora.
Oh.
Is this hands you like this one?
I like that bit.
So some people, you don't see them unless you're looking inside, and some people you really see them, but everybody's different, and it's all normal. It's all normal, but also with the cushioning, it protects the entry to your vagina, your urethra where you pee from, and as you age or with hormonal imbalance, your body reabsorbs fat all over your body as you age, and with all these things. So your body reabsorbs fat, bone, muscle as you age. But people put it down to age. It's a lot to do with hormone imbalance. So if you have this thing where your body's reabsorbing your fat from your labia majora, then it's called vaginal atrophy. When you suffer from vaginal atrophy, you might feel like your vagina is raw. It might happen all the time. It might happen at a time of the month where it's more prominent, but you may notice a little bit of raw, maybe bleeding skin around your vaginal entrance.
Really?
Yeah.
It's that bad it can bleed?
Yeah. You might not be able to exercise, go on a bike, go a walk.
So they're walking around uncomfortable. And would that flare up or be constant?
It could flare up. It could be gradual, or it could be gradual as in like it happens when you get your period or when you're approaching your period, because your hormone levels are changing.
Okay, sorry to interrupt you. I've just powdered the skin so it's nice and like more longevity, but also nice and flawless. And we had used loads of really creamy, dewy products, and that's beautiful, and it'll look really good in camera. But we want it to last, so you end up putting some blurring powders or setting powders on top of that. But now I'd ran concealer over your eyelid. If you just close and let me check. That's creased a bit because obviously it's a liquid and a cream, and if you don't set these things with powder, that they will just crease. Again, it's manage your expectations. If you've got eyes that open and close, like most people do, then you're going to have little lines that makeup will sit into. So before you would set that, just make sure that you smooth that out again. Take like a big brush and just pat on some setting powder or translucent powder, ideally a compact, but it doesn't massively matter. With hooded eyes, so if you look directly at the camera, when Steph opens her eyes, we can't see a lot of the eyelid. So that is just, again, an eye shape. People think it's with age, but there's people in their teens and their 20s with that eye shape. So when I do your eyeshadow, this hooded area, I'm just going to keep this the darker shades a little bit higher here, but I'm talking about, we're not in 2006 anymore, that we're going to make sure that's dark up here and it's light here on the eyelid. I'm just going to use more bronzy tones. I'm actually going to use a bronzer, not bronzy tones, and just make sure that that sort of more shaded area with the bronzer is going to go here. So Steph, you had mentioned already who the treatment's for. So anybody that's suffering with sort of vaginal dryness, they have noticed the lacking of the plumpness here, and the inner lips are, you know, a bit more visible. So, and they can be chafing against underwear or clothes. So if you have those sort of symptoms and you're feeling like it's not particularly manageable, you contact yourself. And what's the treatment called, and what's it entail?
So the treatment is called Deserial. There's Deserial and Deserial Plus, which are the two treatments for vaginal rejuvenation. The Deserial is the internal treatment. So you say internal and everyone thinks, oh my goodness, it's like going for a smear. It's absolutely not. It's the treatment area is just inside the vagina. So there's no stirrups or anything involved. Like, it's not that invasive. And
That's what I imagined.
Yeah.
I thought you were like smear, legs up, spread.
Yeah, no. So you're sitting on a couch and might have to adduct your knees a little bit. The treatment, the Deserial, the skin, the internal treatment, literally takes 2 minutes. it takes longer to numb the area than it does to do the treatment. And it's like either 3 or 5 tiny, tiny little injections into the right area, depending on your symptoms. And you feel the benefits. So it's a hyaluronic acid treatment, both of them. So with the hyaluronic acid, it draws in moisture. And if you do suffer from vaginal dryness, then it's drawing in moisture to the area. So you might be able to have sex without having pain, or walk without feeling pain, etc., etc. The Deserial Plus is an external treatment. It's a filler. So the Deserial is more like a skin booster.
Okay.
The Deserial Plus is more like a filler.
So for the Deserial, am I saying that right? That is hyaluronic acid. So for anyone that doesn't know, hyaluronic acid boosts hydration.
Yes.
And it's a moisture binder, is that right?
So it draws in moisture.
Draws in moisture from your body.
From your body.
So that's for the say it again.
Deserial.
Deserial, and so that's the internal. So we inject it with we freeze it, you inject with hyaluronic acid, that's attracting the moisture from your body. And is that in turn going to plump?
No.
Okay, what's it doing?
So that's it. That is solely drawing in the moisture.
Oh, so that's just helping.
It's tackling dryness.
And is that then that's Deserial?
That's
one done.
Yeah.
And then Deserial Plus.
Deserial Plus
is
the vaginal filler. So the hammock, the cushion that we spoke about, that if it's disappeared or reduced, then, like we said, it's going to cause exposure of the internal tissues to external, and it's meant to be supported, it's meant to be protected. So if you take that away, then that's when you get all the symptoms. Deserial Plus is also hyaluronic acid based, and it draws in, but it's a filler, so it's a hyaluronic acid filler which draws in the moisture and keeps it there. So again, you don't use a lot of product, it's using the hyaluronic acid to draw in moisture and plump the area in order to protect the underlying tissues. So just to the side, it's 2 injections, it's fully numbed, it's like a 3-step numbing process just to make sure it's completely numbed. So you're numbing the external skin, you're then numbing the internal tissue before you actually use the filler. So the actual filler treatment should be comfortable. And you have this bit. So if you're standing up straight, you'll see your external majora. It's like the bit that you see if you're standing up, or if you open your leg, that bit.
Yeah.
Does that make sense? This bit. So if that's flat, you're replumping that. So you would notice it visually if you're standing up, and it might look a bit flat, where it's meant to have a little bit of plump to it. I always think of people in camel toes. See, if you have a camel toe, you have a nice plump labia majora. If you don't have a camel toe, you're like, oh, is that a bit flat?
Oh, so when I'm like complimenting people, it's like, oh, you have a nice cupid's bow or a nice eyelid. You're going, oh, camel's toe. Well done, you. Okay, so normally, again, we're thought to think that's bad. Like, oh my goodness, we've been taught everything wrong. Keep your head still. I'm going to do a bit of liner. Follow my finger. I'm just going to do a bit of liner in the inner part. And then look straight ahead at the camera. And I'm going to just extend your eyelid a little bit here. I wanted to show, if you look straight ahead at the camera, with Steph, who does have a hooded eye shape, so you just have more of that sort of almondy shape eye, but then the skin is slightly overhanging. So what's going to happen with you is when you try and do eyeliner, it kind of just closes in the eye and gets a bit lost. So I'm trying to keep it on this outer edge and actually sort of fake bringing out the eye a little bit. And then when we apply a lash and mascara, that'll just tie into that. But what I wanted to show is when you look straight ahead, then we are connecting so using like a sharp brush, we are just pushing from your natural eyelash line across that skin and upwards. And when your eyes open and looking directly at the camera, it should look fairly like a straight line. And depending how like editorial or dramatic you want that to be, you could keep extending it out. And because I wanted this to sort of talk about, it might not be your everyday look, just going to work or something, but it would be great for an evening. But when you actually close your eye, then with a hooded eye that you do that, it turns into this bat wing shape. And that's perfect. That's absolutely fine because you can't have a straight eyeliner look. It just is impossible. And it will look silly when you open up your eye. So you have to do it with your eye open, and you have to use something like a brush just to blend it so that with the eye open, it looks straight, and with the eye closed, it looks like a squiggly sort of line like this. So it's almost like an outer edge triangle with just that little bit there. And that's perfect. That's what we're actually looking for. So, Steph, I've just applied the other side with the liner and the mascara, and we're popping on a lash. So hopefully you see this in camera, but the lash I've chosen for Steph's eye shape is like a fanned lash. So it doesn't really have like a shorter or a longer side. So I could do this on the left or the right. It doesn't matter. It kind of goes a bit longer in the middle. So it's giving you more of like a lift over the eye. And the key to applying a lash is honestly the glue being like almost dry, but also apply it into the middle, and you're checking with your eye that it's not going to be too long for the outer side. So you're sort of popped it in the middle, but you know that where the middle is because you know the end has to go where it needs to go, and the inner part can't be too close to your tear duct because it's actually uncomfortable every time you blink. So it's kind of keeping the client happy and comfortable as well. You don't want it to be too close, okay? So that looks perfect to me, and we'll carry on with the rest. So we talked about the treatment itself and who it's really for, but is this a one-off treatment? You just get it, you know, the one time and then you're cured forever?
So no, like all filler, it does get reabsorbed, but the fact that it's a filler and it's cross-linked, then it lasts longer than just putting hyaluronic acid into the area. Hyaluronic acid gets absorbed by your body, so the fact that it's cross-linked and in a filler means that it's going to last longer, but not forever. So it generally, depending on the where you're starting off, like your starting point, it'll last between 6 and 12 months. So if you feel like vaginal atrophy is quite severe, then you might, not very many people will require a double treatment, but you might require a double treatment in order to get the time out of it.
And hold on, is that because of the appearance or because of the feeling?
Because of the feeling. Okay. So it's more directed by people's symptoms, but some people have had it just because they don't like the fact that their labia majora isn't as plump as what they would like. Because so people get it just for aesthetic reasons.
Yeah. And you explain when you stand up straight, obviously this little bit in the line, whereas if the inner labia is coming out, this treatment will help that as well because you're naturally plumping outside, so it's cocooning the inside.
Yeah, so vaginal atrophy, like we said, the fat is getting reabsorbed, which will make your lips look longer. Some people might just have long lips even though they've got a plump labia majora, but some people might have a naturally less plump labia majora, and if they want, then they could have the labia majora filled so they are more plump, and then the internal lips might look less long.
So you have said then it'll really help the feeling and the discomfort, and is that how somebody knows then they need to replenish the area?
Yeah, so if you were to have the treatment and you thought, oh, actually that's getting a bit uncomfortable maybe after 8 months, then I would probably recommend not waiting until it's really troublesome again. You would get the treatment when you feel the symptoms starting to return.
So as soon as they start to return to it, as opposed to right back to square one.
Yeah.
Is there any people that can't get it? Like it's too severe, or like who can't get it?
No, if there's a history of genital herpes, like warts, then when you're interfering with the skin, you're puncturing the skin, and that can reignite a herpes
flare
up. If someone is currently going through cancer treatment, then I would say wait till they're finished.
I'll just do your body gloss
Okay.
So we're just going to tie in of these gorgeous Sol de Janeiro, is that how you say that? Body glosses, and they just give that like Hollywood finish over the
Nice.
chest and the collarbones and everything. Ask treatment cost. Obviously, it should vary, or it will vary depending of your location.
So for myself, it's obviously a new treatment. I think there's maybe one other clinic that offers it in Scotland, but the amount of people that know about it is very, very minimal.
In all of Scotland?
In all of Scotland.
Wow.
So it's mostly London, so the prices are obviously hiked in London. But for myself, offering it, it starts at £250, and that's for the internal filler. Some people might just need the one treatment, or the Deserial or the Deserial Plus, but a lot of people would benefit from both. So because of that, so the Deserial starts £250, the Deserial Plus £600. But if they require both treatments, then there's a little bit of an offer where you save £150. So then it's £700.
Great.
For both.
So I've got your body gloss on. Woo! Your collarbones are shimmery. So your two treatments you've just mentioned, some people want both. There's almost like a package deal. However, can you have both on the same day?
You can have both on the same day. You're completely numbing the area anyway. So it's not any extra numbing or extra process.
So thank you so much for coming and being a guest on the podcast and talking all
me.
of your expertise. And how do people get in touch with you if they think this treatment might be for them or someone they know?
So I'm on Instagram for it's Arise Aesthetics Limited.
And remind me what salon you work in?
It's Crea Medispa.
And is that in
That's in
Kilmarnock?
Kilmarnock.
So thank you very much, and I'm going to do your lips.
Thank you.